Telemedicine. Have you done it? Have you heard about it? It's all the rage right now, but what's it all about? Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today, we're going to talk about telemedicine and its role in the new type of healthcare. Stay tuned, it's right now. There are so many ways to get care, and I never in a million years thought that one of them would be through a telephone or on a Zoom call. What is telemedicine? Telemedicine, especially since the pandemic, has blown up. And what it is it's a visit with a doctor or some sort of healthcare specialist without being there in person. Now, when I first thought of this concept, I thought, man, how in the world is this going to work? And I know for me as a chiropractor, obviously, I can't put my hands on a patient. I can't what we call palpate their spine and feel their muscle tension. I can't do a lot of things, and I certainly can't deliver adjustment over the phone. But for so many types of providers, ranging everything from a general care practitioner all the way up to a mental health provider, there's so many things that can be done via this technology that helps people get really quick results and helps them understand what their next step would be and helps them start feeling better right away. So I'm a big fan of telemedicine put in the right context. For me, I would much rather see my doctors face to face. I want to make sure that I understand, that I can ask questions, but I'll tell you, if I had a hard time getting out and around, or if I was in a location where the doctors were far away, or if there were even issues with me feeling ill and not wanting to get other people exposed, then telemedicine falls right in line with a great way even for me to get care. So when should you use telemedicine? Number one, find out if it's a good part of your plan. Most insurances now do cover telemedicine, so it's easy access for you. So if you need easy access where a ride might be difficult or that the distance might be far, use telemedicine. Another time to use telemedicine is in an emergency situation where you have a question and you don't know what to do. Oftentimes you can get into telemedicine visits very quickly, and so you can at least ask the questions. They're going to say, should you take the next step and go to an urgent care, an emergency room, a specific provider type, or that kind of thing. Now, when I wouldn't use telemedicine is if it's something that is actually going to need some physical connection or contact with that provider. For example, a massage therapist, an acupuncturist, again, a chiropractor, those types of body work medicines, they're very challenging in order to get those kind of techniques replicated on your own. More than likely, you're not trained in acupuncture and don't know where to put the needles. You can't adjust your own back. You can't do massage on yourself in a certain way as someone else can. But that being said, those types of providers have gotten very, very innovative in being able to help people with telemedicine. For example, with chiropractic care, people can actually use foam rollers, and not to adjust the spine, but to bring mobility to the muscles around the spine, which takes some pressure off of restricted segments. Physical therapists do a great job in telemedicine, especially on video, of being able to demonstrate exercises and see that you're doing your exercise correctly so that you're not causing more harm than good. Acupuncturists can show acupressure points on certain parts of the body. So even in these types of disciplines, and by the way, massage therapists, foam rollers, lacrosse balls, they can help guide you in some self-administration sessions. So there is a role for telemedicine, and I am a big fan of it. If you have a question about telemedicine, please, or a comment about telemedicine, let me know. Email me, jim@ramoslaw.com. And of course, if you found this video to be helpful or give you some sort of insight, would you please do me a favor and share it? It would mean the world to me. Thank you so much for watching, and remember, your health matters.